Welcome to Healthcare for All Second Wednesday Speaker Series. Tonight we will be having a discussion with Vinny DeMarco from Maryland's Healthcare for All and with Maryland's Citizen Initiative program to talk about how to get things done and how to move forward on the progressive goals that we've been talking about. Vinny will start us out with an overall view, and then we will have a question and answer period. And we will pull those together and start that at the end of his presentation. First, let me acknowledge that I'm participating in this Zoom meeting today from the land of the Coast Salish peoples. Our efforts to achieve healthcare for all includes the peoples of this land. And please take a minute to acknowledge the peoples in the lands where you are joining us today. We acknowledge all the ancestral homelands and traditional territories of indigenous peoples who have been here since time immemorial. And as we discuss the public health changes that we are pushing for tonight, we acknowledge that indigenous peoples have guided us for community action, for supporting their communities like that. Our efforts include universal healthcare coverage for the Coast Salish peoples that touch the shared waters of the tribes and bands within the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. So thank you all for joining us. Let me bring Vinny into the picture. So Ron, if you could highlight him. He has reached out to us and found the work that we've been doing. While it's incremental work, we have focused on how to provide coverage, universal coverage for everyone. And Vinny too has been doing that work, as well as a number of social justice actions. He has found the state legislators that seem to be tied into lobbyists or to locked into their own individual differences, and he's found that they don't always hear or don't always follow the public will. So that's what we're going to talk about tonight, is how I've asked Vinny to share how he's made some of those changes over the years to overcome those barriers and to move the public will into becoming political power, to transform public will into political power. So Vinny, why don't I turn it over to you, and you could tell us the work, not just with healthcare, but give us some of your background about how you got to where you are and some lessons that we could learn along the way.
Well, thank you very, very much, Ronnie. I'm honored to be here with you all. It was great to meet you recently by Zoom and by phone call, and I've always been a great fan of all the work of Healthcare for All Washington. We share that name and that goal: quality, affordable healthcare for all of our people. And I was really honored and happy when Ronnie invited me to be part of this meeting this evening. And what I'd like to do is talk with you a little bit about how a group of us in Maryland have, over the last several decades, put together a program that has really made significant progress in public health and climate justice and gun violence prevention and other progressive and social justice goals in our state. And for me, I was born in Italy, but grew up in New Jersey and Maryland, where I went to Johns Hopkins undergraduate, and been very, very fortunate since the 1980s to be working on public health and climate justice and gun violence prevention issues in Maryland and across the country. And in this work, I learned two very important lessons. And one is that no matter how intractable a particular problem may seem, there almost surely is some experts, some policy wonks somewhere at Johns Hopkins Bloomberg School of Public Health, at University of Washington, or somewhere, who has thought about the issue and devised a smart, evidence-based solution for that problem. Lesson two that I've learned is that the vast majority of Marylanders, and I believe people in Washington and people across the country, support these proposals, support these evidence-based public health, progressive social justice issues. But also, I learned that it's not everybody. And there is, as you found, and I found often, a smallish but loud minority that opposes these goals. I'll never forget one time I was making a presentation at a local community association in my neighborhood about gun violence prevention, and they supported the program and we made some successes. A few years later, I came back to the same community group to get their support for tobacco tax to reduce teen smoking. And this really big guy at the front of the audience got up and said, aren't you the guy who came after my guns? Now you're trying to take away my cigarettes. Next thing I know, you're coming after my ham. Well, I told him I would leave his ham alone. I didn't tell him I was a vegan because he probably would have shot me right then and there. But we calmed him down and the group supported our proposal and we succeeded. Now this gentleman, and I'm embarrassed to say it's almost always gentlemen, who oppose these proposals are not the reason they often don't get enacted. These guys are loud, but they can't block it. What blocks public health proposals in Maryland, and I believe everywhere, are powerful vested interests like the gun lobby, the tobacco lobby, the alcohol lobby, prescription drug companies, et cetera, that have a vested interest in the status quo and use their clout to prevent progress. And that's happened over and over again in our state, and I'm sure yours and elsewhere. Well, over the last 3 decades, a group of us have put together what's turned out to be a very effective 6-step approach to overcoming these kind of obstacles. And what I'd like to talk to you about today a little bit is these 6 steps, and then certainly answer your questions and discuss them. But one of the things that I've been honored to do is work a lot with my son, Jamie DeMarco, who works on climate issues, and he's great and has taught me a whole lot. And one of the things he taught me is if you really want to reach his generation, you got to have video. And my day was everything in writing, but we have a video, and I want to play for you, or Ronnie's going to play for you a video that we put together about our 6 steps, and then I'll describe them in detail. You want to play that, Ronnie?
While grassroots campaigns need to be strategic, they definitely don't need to reinvent the wheel. There's a proven path for success already being used to transform public will into political power across the nation, and it's explained in the book, The DeMarco Factor. It's a multi-year process, but we can summarize the main points in under 2 minutes. Step 1. Create an evidence-based policy plan. This is where you work with local experts and grassroots organizations to develop a watertight, proven policy solution. Don't skip this step. This research sets you up for success throughout your campaign. Next, test the plan with a high-quality poll. If you're going to get groups and politicians to sign on to something, you'd better make sure it moves voters first. And don't skimp on polling. Reliable results from a respected firm get you the credibility you need. Now you're ready to build a coalition. Create a resolution for groups to endorse and work hard to get lots of important organizations signed on. Got your coalition? It's time to bring on the media. The more media, the better, because media coverage builds public support for your cause and motivates your supporters. The 5th step is to make your policy into an election issue. This is when you leverage your coalition's strength to make candidates for office endorse your resolution. Then, let the voters know which candidates have endorsed it and which have not. And lastly, go win in the legislature. Because your powerful coalition got the candidates for office to endorse your cause, you begin the next legislative session with the support of a strong number of legislators committed to get the job done. You've built a powerful grassroots movement and are in a prime position for your policy solution to pass. Ready to learn more? Visit healthcareforall.com/6steps.
So, ladies and gentlemen, I'd like to talk about these steps. And a video mentioned a book, which I'm very proud of. It was written by Mike Perchik, who was Jimmy Carter's terrific FTC chair and an advocacy leader, recently passed away, named Michael Perchik. It's called The DeMarco Factor, Transforming Public Will into Political Power. And if you're interested in what I talk about, I would urge you to purchase a copy of that book. It's very well written by Mike. So let's talk about these 6 steps. So the background is you've got a problem, and a public health problem. Too many people don't have health care, too many kids smoking, the climate's falling apart, whatever it is. And you have broad public support, but you have a powerful vested interest of opposition that keeps progress from happening. Step 1 is talk with experts to come up with a smart plan to deal with whatever the specific problem you're trying to address. And when you come up with the plan, work with your experts to come up with a Washington state-based document that describes how your proposed solution will address the problem you're trying to work on. When we were trying to make high-cost drugs more affordable in Maryland, we talked to some experts who helped us come up with the plan for a prescription drug affordability board, which will put upper payment limits on what people pay for high-cost drugs. We were the first state in the nation to pass it in 2019, and it's wonderful that Washington State has passed one even stronger than ours, which is great. But whatever the issue is, come up with a document, as we did, that describes how the problem of high-cost drugs will be addressed by Prescription Drug Affordability Board. Or if you're trying to reduce underage drinking, when we worked on that, we talked with experts who taught us that raising the alcohol tax would be a great way to reduce underage drinking. And on the alcohol tax campaign, our experts put together this wonderful document, which documented carefully how a certain increase in the alcohol tax would reduce underage drinking and save lots of lives, and bring in money to the state that could be used for healthcare expansion, which ultimately happened. I'll never forget, our expert wrote this great study that was brilliant, every word of it, except for the title. The title was something like, alcohol taxes may save lives someday, somehow. And I said, David, that's a horrible title. I want the title to read, Alcohol Taxes Save Lives. And he said, no, you can't put that on an academic paper. So we went back and forth, and we came up with the potential public health benefits of an alcohol tax, which was better, but still not good enough for me. But it didn't matter because I wrote the press release, and on top of it, it was a big press release that wrote alcohol taxes save lives. But the fact is that report opened the door for us. So the experts' studies help open the door. That's step 1. Step 2 is polling. You want to really know, before you move forward with our steps, that the public strongly supports your proposal. And everything we've gone forward with, including a prescription drug board, the alcohol tax, tobacco tax, and licensing handgun purchases, whatever it was, we did some really in-depth polling. And for all of these, we found broad public support. But we wanted to dig deeper and determine whether the public supported this proposal strongly enough to make it a voting issue. So we asked 3 questions. Question number 1, in the next state election, for whom are you going to vote, a Democrat or Republican? Straight up generic question. Question number 2, if you knew that the Democrats supported X, whatever you're proposing, dollar increase in a cigarette tax, prescription drug board, whatever it is, and the Republican opposed it, for whom would you vote? And question 3, what if the Republican supports it and Democrats opposed it? In our polls in Maryland, this is interesting, since the 90s, we have found on question 1, the Democrat was up by about 20 points. It's always been consistently that way. Question two, whatever we worked on, we found tremendously more support for the Democrat. The Democrat supported our proposal and the Republican opposed it. But then when we asked question three, voters switched toward the Republican, so the Republican was sometimes ahead. And what those three series of questions showed is that there's deep support for our issue enough that people would switch their allegiances. Now, saying they'll switch their allegiance doesn't mean it's actually going to happen. That we have to talk about in the next step 5. But in step 2, through this polling, we learned that we could do these 6 steps. Now, others have wanted to work on other issues where they didn't find this. For example, increasing the tax on sugar-free, sugar-sweetened beverages, soda, etc. There are a lot of evidence showing that that will save lives, reducing childhood diabetes and reducing obesity amongst children. But when you do polling, you don't find the same kind of broad support and make it's a voting issue. So you could find from this polling that you can't do these steps. You got to do something else to educate the public. But assuming you find the strong support and that people would make it a voting issue, step 3 is like the backbone of our success, is to build a broad coalition. Build a very, very broad coalition, including groups all across your state who will be supportive. And two important rules that we've followed. One is have a document for groups to sign on to be part of your coalition. And for me, I've had an ironclad rule of no more than 1 page. If you can't do it in 1 page, start all over and make it 1 page, because you're going to really busy people who have a lot on their plates. And if you can tell them all on 1 page, you got a chance for them to look at it. You have supporting documents. Of course, you have a website, but in that 1 page, what the problem is and how your proposed solution would deal with that problem. Once you have the document, it's very important to build a broad coalition and take time to do this. I have spoken with groups all across the state, all across the nation, that didn't do that. They didn't spend enough time. It's like, I want to spend a couple weeks building a coalition. No. We spent years. We stepped back from the legislature, stepped back from getting something passed right away to build a powerful coalition. Went to the NAACP, AARP, unions, and faith groups, a lot of different faiths, all different kind of faith groups, to get them to sign on. On our prescription drug affordability coalition, we have over 450 faith, labor, business, healthcare, and community groups from across Maryland who support our proposal. And we have this wonderful logo flyer with one of my young colleagues that put together. I don't know how she did it, where the logos of all the top groups are on there. And the most important thing to think about as you're getting groups to sign on to your coalition is what I call the wow factor. What are the kind of groups that if the legislator or whoever you're trying to influence sees their name on this or their logo on your flyer, will say, wow, I have to pay some attention. And for some people, it's a group like the major union or NAACP or major faith organization. So you spend time reaching out to those kind of organizations. And these coalition partners give you their name, which is helpful in and of itself, but also they're the ones who will provide the person power to make the phone calls and to contact the legislators. And they will be there, and they will also be the ones, as we'll talk about in a second, who will provide your help in reaching out to the media. As part of building the coalition, it's good to do everything you can to generate stories of people whose lives would be made better if your solutions were enacted. People who lost loved ones to gun violence, people who lost a loved one to the scourge of tobacco or alcohol, or people who can't afford their drugs, who've had their lives wrecked because of the high cost of drugs. And you have those people there as part of your coalition, integral part, as well as the broader groups who can do a lot for you. But building this coalition is very important. I want to emphasize it takes a lot of work, and be ready to answer questions when people ask, is this really going to work? Have the data there for them and be able to really make sure people are with you right at the beginning through coalition. And our coalition really represents a huge proportion of Marylanders and their people who really want to stay involved. So that's step 3. Step 4 is critical, and that's media. Getting the message out beyond people you could reach through your coalition to everybody. I like to say that everybody who works with me knows that I really like to call people, email, and reach out to people, but I can't reach 6 million Marylanders. It's like a giant telephone or a giant email, the media. And as you know, there are three kinds of media: earned media, paid media, and social media. And for me, my favorite to work with is earned media. It's when you get articles in the newspaper, get something on TV, get something in the radio and news about what you're doing. Whenever we do something major, like a report showing how our proposal will save lives, we do a press conference. A new poll, we do a press conference. Major organizations support what we're doing, we do a press conference. When all the top faith leaders in Maryland endorsed our tobacco tax early on, when everybody said we couldn't ever do it, we held a press conference which got tons of media. And I'll never forget the head of the United Methodist Church in Maryland said that he wanted to kick the butts of the tobacco companies, and he was livid when that wasn't in the paper. But what was in the paper was the head of the United Methodists saying that, the head of Lutherans saying that for centuries the Lutherans have made fun of the Methodists for getting so upset about tobacco. I'm here to say the Lutherans were wrong and the Methodists were right. We're going to work with you guys to raise the tobacco tax. And that made front page paper. That was in the paper, in the article, clerics back tobacco tax increase. And that night on TV, there was an icon behind the anchor that said something like God versus tobacco. Very hard to beat that. So the faith leaders can help us a lot, and they're media savvy people many times. What you need to do with earned media is have a good messenger, like the faith leaders, like someone who's been hurt by the high cost of drugs, somebody who's a good messenger, an NAACP, AARP leader, and a good message. Make sure you have a very good message. And to do that, we did on the prescription drug issue focus groups. And we learned that for the issue of prescription drug affordability, the best message is drugs don't work if people can't afford them. And we made sure we said that over and over again. On some of my other work, we use different messages, like alcohol taxes save lives or tobacco taxes save lives. And whenever I or any of us talked to the media, we said our message over and over again. And make sure that your messengers are brief, but briefed about the proposal, but make sure they're people who are articulate and can really have a story to tell. And at least I found it's not a good idea to kind of give them word for word what to say, because things can come from their mouth that could help you so much. One faith leader talked about his older sons in their 20s who wouldn't stop smoking, and he and his wife were very upset about what happened to them, but the tobacco tax went up and their lives were saved, he said, because they stopped smoking. We ran an op-ed based on that, on how the tobacco tax saved this faith leaders' lives, and that made a lot of difference. Op-eds and opinion pieces are also very important on all these different kinds of issues. On the prescription drug issue, we had one doctor at Johns Hopkins who told us how when an older woman died, or a grandson came to see her and said, "What killed my grandmother?" And the doctor said, "I had to tell her it's because she couldn't afford her drugs." And that was really powerful. And we helped her turn that into an op-ed, which really worked. So use the earned media to the hilt. Paid media is paid media. You gotta pay for it, and it costs money. But if you have the money, ads are very effective. For our prescription drug bill, we had some major county executives of our local jurisdictions do ads about how important increasing this, giving the Prescription Drug Affordability Board authority to make high-cost drugs more affordable would be for their governments and for the people of Maryland. And those were very, very important. So paid ads are important. Third is social media. And I have to embarrassingly say I'm too old to really have social media. I don't have Facebook. I don't have anything, but I'm smart enough to know that you've got to be on social media. And there are younger people in their 30s who work in our organization who have a really powerful impact with our social media. You can go to @HealthyMaryland to see our Twitter and X and whatever we're doing there. And also we have a Facebook page, and we are constantly putting out messages. Like just the other night, the chair of the health committee put something on her, tweeted out that how great the Prescription Drug Affordability Board is in Maryland and what we're doing. We made sure that went everywhere. So you got to have the social media. So you use the media to get your message out. Step 5 is something we have done that's been very different than what a lot of organizations have done. And that is we work to make our public health issue an issue in elections. Now, we don't endorse candidates. We never do that. But we, at election time, and our elections are every 4 years for state offices, are not this year, but on off years, our governor and General Assembly is up. Whatever issue we're working on, we take that resolution that all those hundreds of organizations have endorsed, and we turn it into a candidate's document, a candidate's resolution. And we send that at the beginning of the election cycle to all the candidates running for governor and General Assembly, which is our state legislature. And we demand that they endorse, whether it's a tobacco tax increase to save lives, or an alcohol tax, or a Prescription Drug Affordability Board, whatever it is. And we give them a deadline. We used to call that a candidate's pledge. And I remember candidates in the 90s and early 2000s just hated the word pledge. And one candidate said, I love what you're doing, Vinny, but I'll never sign a pledge. I said, would you sign it if it was a resolution? And she said, sure. We always call it a candidate resolution now. And they don't want to sign it, whatever it's called. They often don't want to sign it, but your job is to go beyond that and make sure they do. And how do you do that? Once you send the document out, you have your coalition descend upon the candidates. They are used to people lobbying them, of course, during the session. They're not as used to people coming to them during election time and saying, hey, you want my support? I want you to support this resolution for prescription drug affordability or healthcare for all, or whatever it is. So your coalition partners can really have a much more dramatic effect than they have during a regular legislative session at election time. And I've been doing this since 1994, and time after time, that has allowed us to beat the big tobacco or big drug companies or anybody else, because we made it an election issue. And through this process, the people of Maryland spoke and overcame the power of these vested interests. I'll tell you one story which highlights how effective this program is. In 2010, we were working on trying to increase the alcohol tax, which, as everybody said, can never happen in the state of Maryland. And so we did all the steps I talked about, and it came to step 5, sent something out to all the candidates, and we had our coalition demand that they endorse us. And many of them did right away, because they heard from their people. I remember vividly one senator who said that he didn't want to have any alcohol tax increase, and he hated public health stuff like that, whatever the stuff Vinny DeMarco wants. He hates it all, and he would not support it. He was being challenged by a really young man, almost half his age, who signed our resolution right away. And we were thrilled to get his signature. A couple weeks later, we got the signature of the incumbent. And I was shocked. And I learned that in a private meeting, he said, you know, I hate that Vinny DeMarco and I hate alcohol taxes, but if I don't sign this, I'm going to lose. Because he heard from the people in his district that really wanted the alcohol tax passed. Luckily, he lost anyway. And the guy who beat him, Bill Ferguson, is now the president of the Maryland State Senate. And I'm going to see him tomorrow night at a fundraiser, tell him I talked about him to people in Washington State. So that process worked. And that was step 5. And once we have a list of those who support our proposal, we do everything we can to make sure the people of Maryland know about it. And that has helped us time and time again to overcome vested interest opponents and succeed. So you do all that, but then you still have to do step 6. You still have to do the things that make things happen in the General Assembly, in your legislature. And you got to continue the calls and letters. You got to continue the media, and you got to have a very good hearing. And there are 2 goals to a hearing. One is to have your experts say how a tobacco tax increase will save lives and it won't have these other problems that the tobacco companies say will have, or prescription drug affordability board will work. Here's why. So you do that, and then you show the breadth of your coalition. This is a balancing act because you want to really show how broad your coalition is, but you don't want to overwhelm the legislators or make them bored of what you're saying. I'll never forget, I had a panel of 6 of the top faith leaders in Maryland come before a very important bill, and they were told no more than 2 minutes. And you try to tell a bishop who traveled 3 hours that he or she can only talk for 2 minutes. It didn't work. They talked on and on and on. I thought the senators were going to kill me. But the 6th witness was my friend David Kahn from the Baltimore Jewish Council, who gave the best testimony I've ever heard. Me too, from the Jew. That was it. And he accomplished our goal that the Jewish community was in favor. And I think he got a standing ovation. But you do all that, and then you do those things right, and then you can capitalize on what you did right with steps 1, 2, 3, 4, and 5 and succeed. And once you've succeeded, and I'll stop in a second, Ronnie, and answer questions. Once you succeed, don't forget to say thank you. So many advocates forget that legislators are people too, and they hear it when they do something bad. They don't hear it near as much when they do something well, when they do something good that people like. So many, we send a thank you letter right away. We do press conference, we do all the rest. And so many legislators have said to me, oh, thank you for thanking me. I had never gotten a thank you letter like that. So make sure you thank them, and make sure you work on implementation. So many advocates will move on to another bill. Make sure that the law you got enacted is working. We did that with our Medicaid expansions, make sure people knew about it. And we're doing it right now with our Prescription Drug Affordability Board, making sure it's working well. With our help, I think it will work very well. That's what I'm going to be coming out to Washington and talk to Ronnie about. But we think that our board will be able to make high-cost drugs more affordable January 1, 2025 for state and local governments. First time that anybody will actually do that, I think. And that's a lot of it because of ours helping them implement. So I think I've gone on enough, Ronnie. If you want to stop and ask questions, but thank you for the time.
Yes, so please add some questions to the chat. Cello will be monitoring that, and we'll be gathering those questions. If you also, we have been putting our website into the chat. Please check on those links or go to that link. And if you are able to make a donation, although many of you have made significant donations in the past day or two through Give Big. So thank you all for that, for making those donations. But going to our website, you can also click on the Get Involved button to really start to look at what role you can play, and it doesn't have to be an ongoing every day, every week role. Uh, Although I'm doing something every day or every week, you don't have to do that, and you can still play a valuable role with us. So go to our website and look at that. And go ahead and start to enter those questions. Why don't we bring Vinny back up and also bring in Cello, if I can find you. Ron, do you think you could spotlight Cello so she can start talking with Vinny about those questions? And perhaps I could really ask the first question. And you threw in, you mentioned those main 6 points of getting started, which we've done. We've been working on this for quite a while and have struggled with each of them. I don't think we actually have done a poll, but we have built a lot of our work on polls that have been done by other groups. And my question is, how do we've also spent a lot of energy in focusing on the basic underlying vision or mission that we are trying to communicate to the public, which is this is a social justice issue. Providing health care is not the only thing that determines your health. The public health issues that you've been working on, Vinny, are great examples of uh, uh, gun control and smoking. Those are issues that we're not going to really solve by overcoming or correcting the current system. But we've spent a lot of time building relationships with the legislators. But we need to do more work communicating with the general public. What do you think is the best way to get that message across?
It's a great question, Ronnie, and we believe that the best way to mobilize broad support for healthcare expansion is to get the message out that we all benefit when everyone is covered with healthcare. And when we were working on a major Medicaid expansion in 2007, our then Speaker of the House, a brilliant man, Mike Bush, he's since passed away, but he's really great, worked with us on this. And we talked with him about the fact that when people are uninsured, right, they go to the hospital and it raises uncompensated hospital care, which is a burden for all of us. And he came up with this great phrase, which is the hidden healthcare tax. The hidden healthcare tax. And we made that into a radio ad where we had a couple talking with each other about, did you know there's this hidden healthcare tax where people don't have health insurance? And you and I are paying for that through our premiums. What? I didn't know that. It was very, very effective. And I think that our ability to make progress has relied a lot on our convincing the public and through them the legislators that it's not just the uninsured who benefit, which is important. We need to help those folks, absolutely. But we all benefit when everyone has health care. And now, and I can send you this, Ronnie, we have actually issued a report by a top healthcare policy person in Maryland showing how when Maryland went from 13% uninsured to 6% by fully implementing the ACA, we saved $460 million at least in uncompensated care, which would have gone right into people's premiums. And that helped us pass some legislation this year, following on your lead, to help undocumented folks get health care. Because the more the message could be, we all benefit when we all already benefited when we went from 13% to 6%. And this is proof we'll all continue to benefit when we go from 6% to 0%. So that I think is a very important way to broaden our support.
Thank you. So let me introduce Consuelo or Cello Echeverria, another board member who from Healthcare for All. And Cello has been reviewing the chat, and I'm sure she has questions of her own as well. So why don't you take it away with Q&A?
Okay, just excuse my weird computer setup. There we go. Okay, can you see me? And yes, you can see me now. So Doug Mormon asked a really interesting question. How do you finance your activities and those of the coalition that you work on?
It's a good question. We have, as I think you have, two different organizations, a 501c3 and a 501c4. The basic difference is the 501c3 can take tax deductible money, but there's limits on how much it could do lobbying, and it cannot do any of the election related work I talked about. The C4 can do they can do all lobbying, can do some election work, but can't take tax deductible foundation money. So we have two streams of money that we've been using since 1999, primarily through local foundations. We have cultivated local foundations who believe in our work, and they supported us early on, and they've liked our successes, and they keep giving to us. So that's kind of our foundation, the local foundations. Then there are individuals, unions, corporations that support what our goals are, and we try to get them to give us some of the non-tax deductible money. But those are the main sources: our foundations and individuals and unions.
So just out of curiosity, do you have a professional grant writer on staff?
We one of our deputy directors is really good at that, and
Right.
she joined us as an intern, so she learned everything with us, and now
Cool.
she is terrific. No, you can't have her. No, she's
No,
great.
I'm a grant writer, which is why I asked.
Yeah. Well, it's an important skill. It's not an easy thing, as you know,
Yeah.
and it's something I have to know how to do. And sometimes every foundation is very different. But Suzanne is great at that, and it's helped us a lot.
Thank you. So my second question is from Judy Finn. Did you adapt your model for dealing with federal and state actions and issues?
Yeah, it's a good question. But let me just say one more thing on the financing piece. It's very important. You got to have a smart person writing the foundations, but grants, but have a plan. What we have found works for individuals, foundations, unions, everybody else is have a plan that will show what the problem is and how your proposed solution will deal with it. And as based on previous successes would be very good. So the question was, could you repeat that?
Yeah, absolutely. How do you adapt your model for dealing with federal versus state actions?
It's a good question. It's hard to do these 6 steps at the federal level. I have not done a lot of it at the federal level, although I worked closely with my son Jamie on getting the Inflation Reduction Act passed. That after Joe Biden was elected, of course, and we worked hard, all of us, to get that passed. One of the things you can do is focus your attention where it's necessary. So my son was brilliant enough to say we need to focus a lot of attention on organizing in West Virginia because Joe Manchin might be important, and they turned out to be, as you know, pretty important. So at the federal level, one of the most important things that individuals can do is to focus their attention on places where it could make a difference. But I do want to say, and I mentioned this to Ronnie earlier, we are getting engaged at the federal level here in Maryland. We have our primaries on May 14th. And the day after that, we're sending a letter to all the winners of the federal primaries for U.S. Senate and U.S. House, demanding that they pledge to support or commit to support the Inflation Reduction Act. And we're going to let everyone in the state know who does and who doesn't. And I'm going to urge you all to do the same in Washington and people all across the country, because I would love it if people across the country are making sure that we elect a president and Congress that will keep the Inflation Reduction Act in place.
Great. So, John Britt asks, what if there is more than one coalition? What about competing approaches to the
Well,
same outcome? Like two
yeah,
different
that's
organizations that don't play well together.
it's an excellent question, and I've not had that problem, but we have had issues within the coalition, and situations where people's goals were not, they didn't seem compatible for a while, and we had to work to keep people together. And I think the most important thing to do in these situations is to be open with everybody, have everybody's input, and make sure that you're trying to reach the same goal, even if some of the things you're trying to do are differently. And that came out real loud and clear when we were working on the alcohol tax, because the money was supposed to go for certain things, but didn't end up going for all of that. But we kept people together on the goal of reducing underage drinking, which our alcohol tax did. And we would work together to make sure ultimately the money went where it was supposed to go, which it ultimately did, but it took a couple of years. So I've never had a situation where coalitions competing, but within coalitions, it takes a lot of work to keep everybody together.
Yeah. And Marcia Stedman asks, did any of your legislative issues end up not as law, but as a directive to form a board or commission, and recommendations for studies or solutions or bills to legislature?
Yes, something very similar has happened where the what we wanted to get enacted didn't get passed completely. And our Prescription Drug Affordability Board is kind of like that. We wanted to give our board the authority to make high-cost drugs more affordable for everyone, like your law in Washington has based on our model, but our legislature wasn't ready to do that. So they gave the board the authority to make high-cost drugs more affordable for state and local governments, and required them to come back to the legislature to recommend broadening their authority, which we hope will happen next year. So yes, that did happen with our Prescription Drug Board.
David McClanahan asks, what about active support for Jayapal's bill, improve Medicare for all, sorry.
Active support within, we're focused on state issues, so we don't take a position on that. We did on Inflation Reduction Act because it was specifically designed to improve the subsidies for people under the ACA, but we normally don't take positions on federal bills.
So this brings me to my question for you. If the only pathway for funding for a state-based single-payer universal healthcare plan is through federal waivers to access those Medicare dollars, how do you see small state-based organizations who are already overwhelmed with 3,000 issues and 2 or 4 volunteers, because that's what it is, and we're all old, because that's who has the time, just really honestly speaking. How important is it, do you think, to work on these federal issues, especially Ro Khanna's state-based Universal Health Care Act, which is, the only pathway to a super waiver to allow us access to those federal dollars?
Well, frankly, it's hard for me to answer that question because I'm not familiar with that bill at all, really. But I do say this, that we in Maryland have concluded that single payer is just not going to work in Maryland. We want to achieve 0% uninsured, but we think that it's only going to be workable in Maryland by building on the Affordable Care Act and doing things like you're doing to allow undocumented folks to get health care, but within the structure of the Affordable Care Act and the Inflation Reduction Act, building on those is, I think, the only way we're going to get to 0% uninsured.
Oh, okay. Marshall Goldberg asked from Woodby Island. The opposition to, oh, here we go. The opposition of single-payer healthcare uses the specter of socialism to scare the public about this approach to providing medical care. The public doesn't appreciate the examples of socialism in our daily lives, public schools, public libraries, police and fire protection, just to name a few, from which we all have derived much benefit. Do you have any suggestions for improving the messaging around universal single-payer healthcare?
Well, you know, what you're saying is really smart. I mean, I remember, we all remember those incredible posters people had up said, "Keep government's hands off my Medicare." I mean, that's the kind of attitude you're talking about. It is really ridiculous. We need to have quality, affordable health care for everyone. And again, I think the best, most important message is that everybody will benefit. And I urge you to do the kind of study we did, showing how the expansions that have been done so far have benefited all of us by reducing uncompensated care. I will send you that study, Ronnie, but I urge you to put that in your messaging, that we all pay for there being so many folks uninsured, and we can remove that hidden healthcare tax if we go to 0% uninsured.
I think that's it for the questions.
Well, thanks so much, Cello, for pulling those together.
Thank you.
Appreciate it. And thank you, Vinny, for sharing that information. I'm looking forward to visiting your visit here and talking with people that are within our Prescription Drug Affordability Board. We do feel that it's possible to get single-payer health care. It will be state by state. Maryland is doing work on lots of issues, so it's great to be sharing that with you.
Yes.
We are sharing that with other states. In fact, we're building bridges with Oregon, and you're going there in June as well. So it's exciting to see that. Thank you for those efforts. It's not easy, and but we still feel it's possible. And using the Inflation Reduction Act and to and using the basic Affordable Care Act that did get us help us expand low-income coverage through Medicaid programs in most states, but not all states across the country, is going to be the way to move that forward. It is hard to make things happen on a national basis, but the more of us that are working together, and Dr. Goldberg, thanks for your questions from out on the islands. So it's nice to have opinions and thoughts coming from all over the state. And we will be continuing to look at things. We are using your work, Vinny, the work that you're doing in Maryland to make our Healthcare Authority Board work in that area. We also have a Healthcare Cost Transparency Board that is really taking a stand and is facing up to hospitals and insurance companies and in the industry to make that happen. And we have this Universal Healthcare Commission, like a few other states have done, to move that forward and to overcome the many barriers that are out there. And in fact, I think prescription drug affordability boards actually offer us a microcosm of how to overcome some of the ERISA regulations that have been a real barrier in that area. So thank you for that. Thank each of our volunteers that have helped make it happen tonight. Ron and Cello and DW and Rich, so thanks for helping with that information and for making this system, this program go smoothly. And thank each of you for participating. We do have put our website in the chat, so please take a visit. Our communications team and all of our volunteers have put a lot of effort into working on some of these issues. So thanks, Vinny, for talking about those basics, which we've got to keep in mind all the time. And I think it's added some thoughts to how we can move forward. So thank you all very much. It's 8 o'clock, almost 8 o'clock. So we will call this meeting officially to an end. Thank you all and good night.
You're a great leader, Ronnie. See you all. Thank you.
Bye-bye.